Well, tomorrow, UW students will have a chance to help the fight against COVID-19.
They're being encouraged to give their blood and plasma, especially if they've recently recovered from COVID-19.
Dr. William Hartman runs the COVID-19 convalescent plasma program at UW Health, and he leads the AstraZeneca vaccine trial, which recently started up again. Doctor, good to see you again.
Hi, Dr. Hartman, good to see you.
Thank you for having me.
So why is this blood drive so important?
The blood drive is important for two reasons. Number one, there's a national shortage of blood right now, so this helps fill a critical need. The other is we can always use more convalescent plasma. As the cases grow here in Wisconsin and across the Midwest, convalescent plasma has been a therapy historically proven to be helpful. We need the plasma of recovered individuals, and I give great kudos to these students for stepping up to the plate.
On the UW-Madison campus, there have been about 3,000 students that have had confirmed positive COVID-19 cases. So there is a lot of good that can be done to fight the pandemic now. Can you explain to us how plasma helps? How does it do that?
So plasma, it's the liquid part of blood that contains the antibodies. And because these students have already defeated the virus, they've got antibodies against COVID-19. And so by donating their plasma, they're allowing those antibodies to be given to somebody else who's currently sick with COVID-19, sick in the hospital. And so this is an amazing way that the students are giving back to the community, and just one more way that the community is saving the community.
Giving plasma is the same process as giving blood, correct?
In this case, it will be. Typically, to give plasma, you have to go into a brick and mortar institution that's got the plasmapheresis machines. This is going to be just like a blood drive, and they will test that blood to see if there's antibody. If there is, they're able to extract the plasma from the blood and then use both components in the hospitals.
Does it take as long as traditionally giving a pint of blood?
No, it shouldn't take quite as long as donating plasma, but you know, it takes a little bit just to donate the blood, but there's always Oreo cookies afterwards. So that's
for students, that's a huge incentive.
That is a huge incentive. Let's talk about the AstraZeneca trial, which recently started up again. What's the status with that?
So we received word late Friday that the FDA and the independent safety board that looks at all the data had agreed that it's safe to continue with the vaccine trial. And so we've essentially been given the green light to go ahead and begin to enroll again in the vaccine trial so that we can see whether or not this AstraZeneca vaccine is part of the solution.
What are the next steps?
The next steps, there's some paperwork and logistics that are involved to get consents through the IRB process, things like that. And then we also have to go through and reschedule people that have been canceled over the last several weeks so that they can come back and participate now in the trial. And we have to do the follow-up on the first 37 people that received the first shot of the vaccine. They haven't been able to get their second shot. And so we have to bring them back and get them back in the process.
So 37 people got the vaccine before it was called off.
The 37 people were part of the trial. I don't know if they got the vaccine or the placebo. Only the company will know that. But there was 37 people that were involved with the trial before the pause.
And how many more people are you hoping to enroll?
Somewhere between 800 and 1,000. It's a little bit less than what we had anticipated initially. It's a competitive process now, though, so we will keep going along with the 79 other sites across the country to push to the 30,000 number, which they need to do an effective evaluation of the data.
And this is one of the biggest sites, right? UW?
Yes, we're one of the bigger sites here.
All right, another way you can help out in this fight. Doctor, thanks for being with us today.
Thank you very much.
Thank you, Dr. Hartman. We appreciate your time.
The Badgers Give Back Blood Drive starts tomorrow, runs through Thursday at the brand new recreational facility on campus, the Nick on Dayton Street. The blood drive runs from 11 a.m. to 6 p.m. each day.